4 years ago, it was brought to my attention through a grant called the Texas Healthy Babies Grant. And I was approached by March of Dimes that asked me, would I be willing to start a local coalition to address disparities in our community, infant mortality rate, and maternal death. My question was, we see in Smith County at the WIC offices over 7,000 women. Why did I not know that our babies and our moms were dying? It shows if a mom is involved in WIC, the chances of preterm birth should decrease. But we found that our African American moms come, but sometimes they don't return. It's seasonal. They come during the summer, and come fall, spring, we don't see them again. But the question is why? What causes our moms not to come back? The same thing that's happening in our medical community. They don't trust us. They don't feel comfortable. So here in Smith County, our infant mortality rates show that 7.3 per 1,000 live births result in infant mortality. 1 in 10 babies in the state of Texas die, and it results from preterm birth. Once again, you ask the question why in rural East Texas. One issue we have is hypertension and eclampsia. We don't talk to our moms about it. We don't create a welcoming, comforting environment where they feel comfortable sharing. You really have to allow them to do all the talking so you can learn versus us trying to teach them. When you're trying to teach them, you don't give them an opportunity to share. So we have the issue with hypertension, eclampsia, smoking. A lot of our moms are smoking, and we don't know this because we don't sit and listen. I'm excited to hear that we have those in the community that just simply listen to our moms, where you say nothing and you simply listen to them. We conducted focus groups through our coalition, and we found 52% of them stated they just simply couldn't afford prenatal care. What a shame. So I'm delivering preterm babies just because I can't afford it. The other 51% simply just, they didn't have the information. So you talk about resources. African American moms are not aware of the resources available in Smith County. We don't share it in our communities. That's one of the other reasons. Another reason, 39% of them were turned away simply because they forgot their Medicaid card. What would it look like if we allowed them still to come to their appointment and we just verified it over the phone? We had some moms that reported they simply couldn't get an appointment. They couldn't get an appointment. So we asked, okay, you couldn't get an appointment, so what percentage, about 36%, just simply weren't aware they were pregnant. So over a good number of our moms' pregnancies are unplanned pregnancies. Why is that? They don't know about the resources, once again, in their community. So that makes a difference in your infant mortality and your preterm rates within your community. We always have this catchphrase, knowledge is power, but you have to share it so that others know about the services, what's available to them, and it helps grow and increase the access to resources, because that's what we want. And another thing I'm going to share with you, and it's not what you want to hear, they simply don't trust their providers. They don't trust their providers. So what are we going to do about it? It's important to have training on cultural diversity, how to talk, address things, how to make them feel comfortable in the medical setting so they don't avoid going. And then if they come and they're late, see them. train, just see them. In WIC, we see, and whether you're late or not, you had an appointment, right, Cheryl? Right. And that's one of our mottos, no moms are turned away. Every mom is seen. So our data today just shows us with 1 in 10 babies being born preterm, a good majority of those moms are Black moms. And that's a 10.9%, 1 in 10 babies. But our rates here in Texas amongst the African American moms, 14%. So that's even higher than the state average. So what can we do as a community? Later on, we're gonna hear about that. And I'm excited because I know as a community and the Healthy Me, Healthy Babies Coalition, we can hear this information and take that to heart, and we're going to grow. But we need our community support to talk about it. Go knock on doors, talk to our moms, go in the community, speak to our providers. It's okay to share and have uncomfortable conversations, but we call those courageous conversations, where we talk about subjects that make us uncomfortable. So that's where we're moving to and it may take 2 or 3 visits, but that is our data here in Smith County. And